Good afternoon, everyone. My name is Marie Piquant. I am a student at Herzing University. This presentation is for class NU 673, and I am currently studying to be a mental health nurse practitioner. In this presentation, I will do an overview on the opioid epidemic in America, and it's titled A Talk on Opioid Abuse. The agenda per instruction is the title page, Introduction to Substance, History of Abuse, Prevalence in America, Risk Factor, Short-term and long-term effect, Sign and symptom of abuse, potential for overdose or suicide, example of a care plan for a patient with opioid addiction, and the conclusion. So, to introduce, opioids are a class of drugs that occur naturally in the opium poppy plant. Some prescription opioids are driven directly from the plant, while others are produced in labs using the same chemical structures. Some examples of prescription opioids are hydrocodone or Vicodin, oxycodone, also called oxycontin or Percocet, oxymorphone, morphine, codeine, and fentanyl. Heroin, heroin, is an illegal opioid that is sold in the street. Although these drugs are well known for their ability to reduce pain, they have a significant risk of abuse and addiction. Let's talk a little bit about the history of abuse with opioids. Opioids have been used for centuries for their pain relieving properties. However, the modern opioid crisis in the US can be tracked all the way back in the 1990s when pharmaceutical companies began aggressively marketing prescription opioids as safe and effective treatment for chronic. I'm very sorry. Let me start over if you don't mind. I apologize. So, the pharmaceutical companies in the United States started back in 1990 to aggressively market the prescription of opioid as safe and effective to treat chronic pain, which, however, led to widespread overprescribing, misuse, and addiction of opioids. Prevalence in the United States. Millions of Americans are battling opioid addiction as a result of the current opioid epidemic in the country. The National Institute of Drug Abuse estimates that over 130 Americans pass away each year from an opioid overdose every day in the United States. Risk factor and vulnerable populations. Chronic pain conditions, mental health issues, social economic factors, and a history of substance abuse are some of the risk factors that raise the risk of opioid abuse in individuals. Veterans, people with disabilities, people with history of trauma, and people with limited access to health care are examples of vulnerable populations to the abuse of opioids. Now let's talk about short-term and long-term side effects of using opioids. Ecstasy Ecstasy, somnolence, disorientation, constipation, and nausea are some of the short-term consequences of opioid abuse. While when used chronically, it can result in overdose, respiratory depression, addiction, tolerance, dependence, and even death. Signs and symptoms of abuse. Indications of opioid misuse can include pinpoint pupils, tiredness, slurred speech, falling asleep, mood fluctuation, and behavioral abnormalities. Also, you can observe nude marks, stride marks, and weight loss as physical symptoms of opioid abuse. Also, it is important to look for the signs of opioid overdose, which occurs when a person consumes too much opioids and cause respiratory depression. Potential for overdose or use as a suicide weapon of choice. An overdose of opioid can cause coma, respiration depression, and even death. Opioid can cause respiratory failure, which is why they are often used in suicide attempts. Now, that's the example of a care plan for a patient addicted to opioids. First, we will attempt pharmacological treatments, which are methadone, buprenorphine, and naxalin. These medications can act as agonists and bind to and activate opioid receptors, reducing withdrawal symptoms and cravings for the patient. Non-pharmaceutical treatment include behavior therapy, like for example, contingency management, multi mental family therapy, and cognitive therapy. These treatments are useful in treating opioid addiction. These approaches to behavior treatment have shown results, particularly when combined with medications. Patient education. When educating your patients and your families about the dangers of using opioids, it is necessary to teach them how to store the medication safely, and to let them know how crucial it is to get treatment for substance abuse problems. If an overdose is suspected or occurs, teach them to call 911 immediately to receive medical attention. Once medical personnel arrive, they will administer Naloxone, which is a medication that can treat an opioid overdose when given right away. When necessary, send the patient to a mental health facility for treatment, refer them to a support group or program for substance abuse treatment, and refer the patient as needed and schedule follow-up so that the patient can be followed and given the right treatment and support for the success of their treatment abuse issues. In conclusion, the opioid epidemic is a complex public health crisis requiring a multi-phased approach that includes prevention, treatment, and harm reduction strategies. understanding the nature of opioid abuse and implementing effective intervention can help us reduce the epidemic's devastating impact on individuals, families, and our communities. These are the references I use for the presentation. Please feel free to go over them yourselves. And I thank you again for your attention. My name is Marie Picant. Have a wonderful day. Goodbye.